Hello and welcome. We're so glad you could join us today. As we all know, healthcare costs continue to rise faster than wages. And for many employers, it can feel like those costs are completely out of control. But what if they're not? What if small actions focused on prevention could actually help lower future healthcare costs? What if your employees' health today could reduce your healthcare spend tomorrow? That question is what inspired our Bend the Trend series. This is a year-long movement focused on lowering per member per month costs, not through massive overhauls, but through small, intentional changes over time. Today is about taking that first step. Hello, everyone. I'm Jennifer Austin, Senior Director of Strategic Partnerships, Innovation, and Marketing here at the Alliance, where we help you self-fund smart. Here's what we'll focus on today. First, why preventive care matters, not just for employee health, but for long-term cost containment. Second, the hidden costs of missed or delayed screenings. And third, what employers are doing right now to increase participation in preventive care. Throughout today's session, we'll use live polls so you can benchmark where you're at alongside your peers. There are no right or wrong answers. Your participation helps shape the conversation, so please jump in when those polls appear on your screen. Before we dive in, I want to quickly thank our sponsors, National Cooperative RX, MH Imaging, and Checkups by Pathfinder. Their support allows us to continue bringing practical, employer-focused programs like this to you. You can learn more about each sponsor using the links in the resource box on your screen. When we talk about Bend the Trend, we're not talking about perfection. We're definitely not talking about quick fixes. This movement is about trying small things, testing new ideas, and turning insight into action. We're starting with prevention, not because it's easy, but because it has the potential to make the biggest impact on employees' lives and on healthcare costs. Before we go any further, I want to show you a short video from one of our past symposiums. It captures why preventive care matters and what can happen when issues are caught early. Let's take a look.
We offered, and again, this is just drilling down on our data. We said, let's offer 3D mammography and pay for our plan doesn't cover it, but let's cover that. And so we contracted services with the local hospital that had the 3D mammography, and we had a spike in breast cancer, and which we were like, this is a good thing, I guess, but obviously also a bad thing. But we also had more people that were catching early, stage 1, stage 2, and they were very, they will still come back and say, thank you, because that caught something. Yep, it saved my life. We also started this program for we have an older population that drives our students that drive off-site or that are brought off-site. We said, I think I remember watching something on the news about a bus driver having a heart attack and the bus going off the road. And I said, we really should do just a heart screening on our drivers. And we had 2 of our 6 drivers that had 90% blockage. And, they have both come in and said, you saved my life. Had I not caught this. So I think they're just the little things. And that's that relational piece of really connecting with your employees to say, hey, we should do this. And it's basic.
That story is a powerful reminder that small actions can truly change lives. In both examples, breast cancer screenings and vascular screenings, early detection made a real difference for employees and their families. It also helped employers avoid higher downstream costs, lost productivity, and staffing challenges. As one leader in that video put it, spend money on the small things to prevent the big things. So now let's talk about where to start, because everyone watching today is in a different place when it comes to preventive care. Before we go any further, let's do a check-in. When was the last time you had your annual screening? We know that it's important for us as leaders to set the example. I actually just got mine done in December, so bonus points for me. And I checked in with all of the panelists you'll be meeting with shortly, and they're all up to date as well. So glad to hear that. Although We know it takes time. We know that it's one more thing to do. So it's not surprising that at times it can take longer than maybe it should to get in for those appointments and make sure it's happening. So what I'm seeing so far is about 90% of you are going in for your preventive screenings. That's awesome. I think that's probably higher than what we're seeing for some of your populations. At least that's what we're seeing in some of our data. So love hearing that you all are making that a priority. So let's take one more quick check-in with the second poll. How would you describe your organization's current approach to preventive care? We mentioned it at open enrollment, but not consistently throughout the year. We regularly promote screenings and wellness activities. Preventative care is part of our cost containment strategy. Prevention's a big focus. It's part of our culture, and maybe not sure. That's why we're here. We're trying to learn. I think it doesn't matter where your results come in. I think just knowing where you're at is already a positive first step in trying to figure it out. Because once you know where you're at, you know where you can go. Still waiting for some results to come in. It looks like about 25% mention it at open enrollment, but not consistently throughout the year. That's kind of to be expected. Regularly promoting those screenings and wellness activities, 41%. 15, part of your cost containment strategy, and 10, it's a big focus. And of course, the people who are trying to figure it out, we're glad you're here. We want to learn from each other. When we asked this question internally, we realized our approach had evolved over time. At one point, we relied heavily on incentives to drive preventive care. But over time, that approach became transactional and didn't always lead to lasting behavior change. What made the biggest difference was something much simpler. During an all-stat meeting, a leader casually mentioned scheduling a routine colonoscopy. Nothing formal, no big marketing campaign, just a normal conversation about taking care of yourself. And that actually opened the door. Others started to share their experiences, including how using a preferred value provider made it affordable and manageable. That moment really helped normalize preventative care. And afterward, we saw more employees scheduling screenings and asking questions about where to go. That cost to our health plan is just a fraction of what it would have been if those issues had gone undetected. That's really the heart of prevention. Make it normal, make it easy, and remove barriers. At the Alliance, we focus on building prevention directly into our plan. That means removing friction whenever possible. For example, we have a tier 1 in our benefit plan that is zero cost to employees and gives them access to dermatology, mental health, physical therapy, and preventive screenings. No cost care is really important. There's no referrals needed, and the provider options help protect the employees from unexpected out-of-pocket costs. The goal is simple. Again, make it easy, affordable, and accessible. But cost alone isn't enough. Employees also need flexibility and permission to take care of themselves. It's hard to, step away from the floor, step away from your desk. And often they learn best from each other, which is what that story above really proves. Those real stories build trust faster than any policies ever will. So we're going to add one more poll question before we get started. Where do you in your company see the biggest opportunity to make prevention easier and more accessible for your employees? So are you doing biometric screenings at your open enrollment fairs? Are you promoting cancer screenings during those months? Are you telling people to get their mental health check-ins? We'd love to hear kind of where your focus has been as an organization. So I'm just looking to see what results are coming in right now, and we appreciate you all chiming in with your answers. That just helps us figure out, ooh, we've got 100% at not sure, but I want to find out. That's okay. That's why we're here. So we'll get started today. If your answer is you're not sure, which everyone's is, that's why we're here. Please reach out to your account executive here at the Alliance and let them know. They can actually help you dig into your data to find out how you can make the biggest impact on your healthcare spending. Use the contact us link in the resources box on your screen, because sometimes your claims data can also shine a light on chronic conditions like high blood pressure or diabetes, where that preventative care can really reduce costs and prevent future claims. What's powerful about these results is that every option represents an opportunity to catch problems early and bend the medical cost trend. Most people don't avoid screenings because they don't care. They delay care because it's confusing, inconvenient, or intimidating. Those are all solvable problems. And that's where small, intentional changes can make a big difference. Now that we've grounded ourselves in the why, let's talk about what's actually working in the real world. At this time, I'd like to introduce you to our panel. Joining me today are Philip Blair, Vice President of Human Resources at Gamber Johnson, Renee Klein, a registered nurse from Inovia Health that works with several employers, including Gamber Johnson, and Brian Cornell, Plant Manager at Wasota Tool. Thank you all so much for being here today.
Thank you.
Good morning.
Morning.
Preventative care is a huge topic, and there's a lot to explore here. To get us started, let's talk about what's really at stake and what happens when that care is overlooked or pushed off. Everyone here has seen the impact of preventive care, so let's keep this conversational. Feel free to jump in when you've got something to add. Brian, you've seen firsthand in a manufacturing environment what happens. What are those hidden costs when those screenings are delayed or missed? And when I say cost, I mean financial, operational, cultural. What do you think?
So when I look at the budget here at Wasota Tool, and I look at our costs, our raw materials, we manufacture tools and dies for the canning industry. And when I look at those costs, our number one cost is raw material. Number two is labor. And number three is healthcare. And in controlling healthcare, prevention is key to controlling those costs. And again, like I said, that's our third largest expense. So I can cite a recent example we've had here at Wasota Tool. We had an individual go in for annual colonoscopy. And he went in and had the colonoscopy, and they found some polyps. And based on evaluation of that, they told the individual, we're a little concerned here with what we're seeing in this colonoscopy and the type of polyps they are. We think you should come back next year and have another colonoscopy, because normally it's 5 years. And so he did. He went in 7 months later, and he had a colonoscopy, a second one. And the polyp they were concerned with was back, and it was quite large in 7 months. So they then obviously removed it, and then they said, we've got to get you scheduled for appendectomy, because they felt that was contributing to it. So he has recently just completed that surgery, and they think he's going to be just fine now, and he can avoid colon cancer in the future. So that's just one example of what preventative can do. Had we not did that, I can't imagine the costs we would be incurring on our healthcare program.
Absolutely. And you'd be missing out on him at the plant as well. Like, it's not just the financial portion, it's also him being able to take care of his family. So love.
And then the overtime to cover his position.
Yeah. Thank you. Building on that, how do you see those missed screenings in your claims data? And did you always feel like you needed to make prevention a priority, or did that happen over time?
We've felt that, we've had our eye on prevention for quite a while, for many years. And in fact, one thing we do to help with prevention is we have a health fair every year. And we've been doing that for years. And I can tell you about some missed screenings, two different examples. They're probably not missed screenings that everyone thinks about. The first example I'll tell you, this one is recent as well. I would say this one happened a couple of years ago. We hired a new employee, and he was a middle-aged gentleman, and the previous job he had come from, he did not have good medical coverage. So he wasn't really set up with a doctor. He wasn't doctoring. And so he started with us, and he started prior to our health fair. And just prior to our health fair, we generally have our blood draw in March. And then in April, we bring staff in, and then they, medical staff, and then they review the results with the employees. And this particular individual, come to find out, he had no idea he was pre-diabetic. And now after that, so now he's set up with a doctor, under a doctor's care. He got on a proper diet. He lost all kinds of weight. He started exercising. He's avoided insulin and all the other things that go with diabetes. And he's doing quite well. So there's one example. The other example I'd like to share with you is sort of unique, and it sort of shows the value of a health fair. Is years ago, we were with Big Medical. So we were fully insured, and we were told, this is your network, this is where you go. And so this was actually a spouse to one of the employees. So the way our health fair works is we run the health fair for the employee and the spouse. So the spouse come to the health fair, and we do extensive blood panel. We do a blood panel that's more than you would get at your normal annual physical. And we, with our corporate doctors, we put together the blood panel and the extent of it and what all's checked. Well, this particular spouse, he was doing his annual physical every year, but the blood panel and the workup wasn't very extensive. And when he went through our health fair, he found out he had a blood disorder. And so with that, he was able to get on a course to treat that right away. So the health fair is a great way to get preventative measures to your people. So we had a new employee that we helped out, and then we had a spouse to an employee that we helped out, and he was doing everything right as far as he knew. So
that's great. And I'm sure that matters so much to that family as well, to make sure that he can be healthy and stay a part of his family in a good and meaningful way. Thank you so much for sharing the stories. Phil, I'm going to ask you about your organization, Gamber Johnson. They've been recognized as Wisconsin's healthiest employers and as a great place to work. A company doesn't earn that kind of recognition without doing a couple things right. What are some of the creative strategies you've implemented to make preventive care part of your company's culture?
Thank you for the question, Jennifer. I think when answering that question, I'll put things into three separate buckets. The first is, and you talked about it at the beginning, is incentivizing employees to take the proper care when it comes to preventative care. At Gamber Johnson, we make that super simple. If you get your annual physical and your age and gender specific screenings, you earn a payroll bonus to do that. So that's the first thing that we do. Next, a big piece of it's education. Why is it important to get these screenings? An ounce of prevention is key in our philosophy when it comes to making sure our employees know why it is important and why we think it's such a priority for them and their family members to practice good preventative care. And the last one, which I'll focus on for most of my answer on this, is eliminating barriers. And so one of the things that we set out to do when we went down our healthcare journey was trying to figure out what was stopping employees from being able to seek the care that we all know is so important, and it starts with access. And so one of the things that we did to help with access is partner with a great group like Novia Health. Currently, Gamber Johnson partners with 7 different clinics, making sure that our employees have direct access to great independent primary care providers. Next is cost. That's a big hurdle. Even when it's, coded supposed to be as preventative, we also have a tier 1 structure very similar to the Alliance. And if our employees go through our tier 1 providers, one, they have very quick access, and second, we guarantee no cost for any of their preventative care or any other care related to primary care outside of that as well, if they're using our preferred provider. Then the other one is, well, I don't have time away from work, or I just can't break away. And one of the things that we've done is we prioritize that so much. We have an on-site clinic available for a good portion of our team members. And if our employees are going to our on-site clinic, they don't have to punch out for work. They can go downstairs and see Renee and the team at Inovia, and they'll get the opportunity to get their annual physical right on the job. So one of the things that's been really important for us is talking to our employees, understanding what are those hurdles that are preventing them from getting their annual physical, for getting their age and gender specific screenings, and then doing everything that we can to make sure that whatever those hurdles are, we eliminate them, so that at the end of the day, there's almost no reason why the employee can say no to getting those annual physical age and gender specific screenings. The biggest thing for us is, I always joke with our employees and our families, it's free, we're going to pay you, and we'll give you the time away from work necessary to do it. Outside of that, what else do you need from us? Because we're going to do it to make sure that you get that preventative care. And that's been a really big success. And we can see that in our populations where we have access to great groups like Inovia, the vast majority of our employees and their dependents are up to date with their annual physicals and age and gender specific screenings. And so I don't know that any of the things that Gamber Johnson does are earth shattering, but it's just focusing and talking directly to the employees about what is needed to get them to make sure that they're taking the necessary steps for preventative care.
That's great. And I love you brought up the tier 1 example that works the same for the Alliance, because it actually directly relates back to Brian's story, where he said they went in, they needed to remove a polyp. That might have changed that appointment from preventative to diagnostic, but if you're covering those services, now that employee doesn't need to worry about that. So I love that example.
Yeah, that's always great, because we've all heard those experiences from employees. Well, last time I went to have my annual physical, you said it was going to be no cost, and all of a sudden I got a bill in the mail. And one of the ways that we can control that and make sure that doesn't happen to our employees is our great tier 1 providers, where we guarantee no cost if they go through our tier 1 providers.
Great, thank you. Renee, as a registered nurse working in an on-site clinic with employees, what makes screens easier or less intimidating?
I think the number one reason is we have easy access. Employees, as Philip was talking about, we have an on-site clinic at Gamber Johnson, and patients will walk in. They have same day or next day access to us, and so we're removing that barrier. Also, as Philip mentioned, they don't need to clock out when they come to see us. So they are getting paid for their 1 hour routine physical or whatever else they're being seen for. And that is huge. No one wants to take time off of work and schedule it, and it's just kind of a hassle to do that. So we eliminate that hassle. Also, the other thing is, being, we have accessible hours, like I said, being on site at Gamber Johnson also allows me to walk the production floor and the office floors. We create that rapport and develop that trust with our employees and also their families. We don't treat them as like in the big system, you're treated as a number. Here, it's more personal. Get to know you. You're a person, not just a number. So I think that's key. We have an example here I always refer to is that, we had a gentleman that works here at Gamber Johnson, and when we first opened our clinic here about 4 years ago, he said, "I'm never coming to see you. I don't go to the doctor. It's a hassle. It costs too much." And after a while, I would say about a year of me being visible and on the floor and him hearing from his coworkers that it's easy to come see us, he actually, I wouldn't say a frequent flyer, but he comes for his annual physicals. When he has a problem, he walks through the door and is seen. So we've kind of changed his attitude a bit. And I think it's key to being accessible and developing that trust, non-judgmental environment, and removing those barriers. So,
Philip, I'd like to loop back to you on something related. People tend to respond better when they aren't being told what to do. There's research showing that people prefer questions rather than directives, especially when it comes to changing habits. That allows them to kind of come to their own conclusions and ideally see more adoption. For example, instead of you have to do your preventative screening, maybe what happens if you don't get it? Have you tried posing preventative questions like that? And what kind of responses have you gotten?
Yes, absolutely. I would say I have experience with both the carrot and the stick approach. And I think one of the things that's been really successful for us at Gamber is definitely the carrot, incentivizing education and making it as easy as possible to participate in our programs, essentially making it so that there's almost no reason an employer or spouse could say no to participate in our program. One of the big things that we always talk about from an education standpoint is trying to use real life examples. And, it's something as simple as an example that it doesn't come directly from me. I've heard it from a ton of other groups, but I think it resonates sometimes very well with employee populations is, why are annual physicals and age and gender specific screenings so important? Well, use the car example. Everybody knows what happens if you don't change your oil, you don't rotate your tires, you ignore the check engine light. Well, bad things are going to happen. You're going to get hefty repair bills, or you're going to end up having to buy a whole new car. Well, the same thing happens to the human body, and just trying to put it in those more simpler contexts has really been beneficial for us. So that if your car is screaming that something's wrong and you ignore it, something bad is going to happen. Well, the same thing happens with the human body, and we try to really emphasize that and push that to our employee population. The other big thing for us is always leading by example, so whether it's myself or the rest of our leadership team and our managers is making sure that, when we're promoting and saying it's really important that all of us as leaders need to make sure that we're towing that line and making sure that we're getting our annual physicals, our age and gender specific screenings, we're using our tier 1 providers is a big, big thing for us. And then the last thing that I'll share is always been a really big benefit for pushing and helping to educate other employees is our employees at Gamber Johnson have the opportunity or the unfortunate pleasure to hear me talk about healthcare a lot. But one of the things I think is the most impactful is when I hear an employee come up and say they had a great experience or is exactly what we said it was going to be, and they got the care they needed or they found something early and now the outcome is going to be better. I always encourage them to the extent they feel comfortable, go talk to their peers, because when a peer shares something directly to a peer, I think it goes far more to emphasize or push that behavior amongst a peer than it does from a leader. So your best advocates are individuals that have had great experiences within your healthcare model. And one of the things that we consistently do is try to tap into those individuals to help us spread the good word to our employees.
Yeah, that's great. And we have one employee here who I'll let remain nameless, but she knows who is a great advocate in that way at the Alliance. She has talked about using all of our tier 1 providers and really making it to be a game so that at the end of the year, did she pay $0? That's her goal. Well, honestly, if she can take care of herself and pay $0, more power to you. So we love that. Brian, a majority of your employees don't have just desk jobs. They have to physically be on site on a factory floor to get their work done. This can make scheduling time off for those appointments challenging. And often, and I will admit this for myself, I'll always make sure that I get my kids to their appointments, but I kind of come last. How do you make sure that your employers or your employees are taking the time off to take care of themselves? Are you breaking it into chunks? Are you having meetings? How do you make it more manageable?
Well, I totally agree, and it's a good point. You know, time is money, they say. And I guess to answer that question, I'd like to back up a little bit and sort of explain where I'm coming from. So at Wissota Tool, back in the early 80s, all the way up until 2024, we were a fully insured healthcare program here at Wissota Tool. So we had what I call big insurance. You know, we started out with Blue Cross Blue Shield, then we went to WPS, and then we ended in with Medica is where we had. But, you know, it was a fully insured program, big insurance. You were captive. You were told this is where you go. And where we went was big medical. And when I say big medical, to define that in my own terms, what big medical is, you know, you walk up to the hospital, you see the big ER center, and then behind that, you see the clinic. And then surrounding that, you see all the specialty care, you know, cardiology, orthopedics, what have you. It's all in one big campus. And so that was our network. And recently, you know, in 24, we went to a tiered program like we've been talking about. We've got a tier 1, a tier 2, a tier 3, and a tier 4. And the tier 1 is that no cost option for the employee. And when you look at tier 1 for us, you have that DPC, the direct primary care provider, your clinic. We call him our quarterback for our team. And then we've got our specialty care for orthopedics and that type of thing. And then we've also got the providers for testing and all that. And what we've found since we've went to self-funded is we're talking about saving time. If I go back to when we were big medical, big insurance, it took us out forever to get out of testing, get into diagnosis mode, and then get to treatment. And so the appointments, to answer your question, the appointments and the time needed was crazy. And the costs were astronomical because we were captive, okay? We weren't out there creating competition within the healthcare industry. We don't have that if you're captive. So we were part of the problem for many, many years. We weren't bringing competition to healthcare. And now we're using those preferred value providers, and it's remarkable how fast we go from diagnosis, testing, to diagnosis, to treatment. We're saving our people a lot of time, and we're also saving a lot of money on our healthcare. So you would never get me to go back to full coverage captive care. No way.
Well, we at the Alliance as self-funders love hearing that because we believe that you should take control of your healthcare costs. One of the things I want to be mindful of, because all of our speakers here have on-site clinics, is that you don't have to have an on-site clinic, right? Like you can do many of these strategies by making sure you're working with different independent providers, working with those preferred value providers. So I say that just because I know with small employers, it can feel like, well, I don't have an on-site clinic. There's nothing I can do. Do you all have any reaction to that or any comments on that?
I could chime into that because Gamer Johnson has seen some pretty tremendous growth over the last 5 years. And, you know, If you look back 3 years ago, we had 4 years ago, 5 years ago, we started our on-site clinic in Stevens Point. But as we've continued to grow as an organization, one of the things that we've tried to do is replicate the success we've had here in Wisconsin and our other states. And in our other states, we have tier 1 primary care providers, but none of them are actually on site. So on-site clinic is definitely a huge benefit and it's a great option, but we've seen similar success without having that. And how we navigate that is just making sure that we're doing those same things and being flexible with our employees, but it may not be an on-site option. It might be a near-site option. I do think it is important to try to help your employees find those tier 1 providers whenever you can, because one of the biggest hurdles that we all experience is access. And we've had a lot of success, whether it's on-site, near-site, or forms of direct partnership, making sure that we can help navigate that access issue for our employees with those partnerships. Again, even when it's not on site, if you can help them get access, that's a huge piece of it. But we've seen success, and we have all variations of on-site, near-site. And in some areas, we don't actually have clinics, and we help just go through the traditional healthcare ecosystem.
Great, thank you. Brian, Renee, anything you want to add on to that?
Yeah, with SOTA, we don't have on-site. We went with the DPC that is close by. They have several locations. And the other thing we wanted was quick availability for appointments. So we picked out a DPC that, our people are getting in the next day. They got an issue, they call, they're in the next day. Sometimes it's within the same day. And the other thing we did when picking out a DPC is we looked at, we're a 3-shift operation, so we wanted good availability. So we picked a DPC that had hours of operation that covered at least 2 of our shifts plus our weekends. So with that, availability for employees to get in and get care is really simple. And the other thing I know, and I'll say from being fully covered, we went through this whole thing of each year getting a new contract and being told we're such an unhealthy group and our costs are so high to insure us that we would get an increase each year. And with going the way we are, we're not getting that at all. We're controlling our costs. People are getting the care they need. But back when we were with the big insurance, big medical, and we kept getting told, boy, you're an unhealthy group, you're really expensive to insure, we had to raise premiums to cover the increase, the double-digit increases we were getting, okay? And then, in turn, the premiums would go up on the employees' portion, the deductible would go up. Since we've went to this tiered program with a DPC, premiums have went way down. Deductibles, it's free if you follow the tier 1 path. If you go tier 2, you have a slight deductible. So affordability is just crazy good for the employees. Access to care is really good. We are so much better off. It's crazy. So I highly recommend you look into, you got to invest in your healthcare program. If you want to lower costs in healthcare, you need to get involved. You cannot be captive. If you stay captive, you're going to drive everyone's costs up. You need to get out there, start using these preferred value providers, drive competition into healthcare. I'm in the business of making tools and dies. I can't charge whatever I want for that tool and die. I don't get the job if I'm not efficient, providing good value. We need to get that back in healthcare. And I hope everyone listening does it.
I would like to say, I promise we did not pay Brian to say all of that. You just started with self-funding in 2024, and it sounds like you're already having phenomenal results. So we absolutely love hearing that. And we're grateful to be part of the team that helps make you as successful as you are. So thank you so much. Those are very kind words. Renee, I'm going to ask one more question, and then I'll ask a big question of all of you. You mentioned working with a employee and it took some time to do some mind shift changes. How do you get I feel fine, I don't need to go in for an appointment? How do you deal with that when you're in the exam room? Or how do you help people shift their thinking to get them into the exam room?
Well, the key is getting them in. And once they are in, I know Philip talked about the car analogy, but we definitely use that in conversation with our patients. You're feeling fine, but so why should I be seen? So it's the same, your car, you have to have regular maintenance, oil change, tire rotation, your car, just to keep things running in tip-top shape. And our body is the same way. So we believe in proactive versus reactive. So it's all about preventative care and catching those potential problems before they escalate. Many things are, we talk to our patients about, silent diseases, silent killer like hypertension or high blood pressure. Doing our screenings, we can find, we check patients for high blood pressure or check their blood pressure in our screenings, and they may not have known that they have high blood pressure until we take it. And, they've had no signs, no symptoms. They feel great again. So getting them in and just doing the simple things can stop something from becoming a chronic issue. And blood pressure, pre-diabetes. So in our screening, our biometric screenings, we draw glucose, fasting blood sugar. And some people may not realize that they're teetering on being diabetic and they're pre-diabetic because they feel great. So we can catch that soon and early and hopefully put them on a course where they aren't going to become diabetic. Again, like I said, catching things early is key, and just having those conversations with your patients and not pressuring them, taking it slow, and it could definitely change their thought process and mindset. So
Great, thank you. And then my final question for all of you, many employers hesitate to try something new because they don't want to make big changes or have major overhauls. Do you have a suggestion for just one low risk, small step you think they could take that would be meaningful to help with that preventative care participation? Renee, do you want to start? And then we'll go to Brian and Philip.
Something I think could help employers is choosing a direct primary care partner that allows easy access to same day, next day services, and a lot of availability to help support your employees. So I think that is key, picking the right one, the right partner.
Brian?
I think number one, I meet with my staff, the whole group, with employee meetings, all 3 shifts. I do it about 6 times a year. And every meeting, we always talk about health, the importance of health. I give them an example. How do you think your life would change if one of your arms was broken today, and because you take it for granted all the time. And then I say, well, move that broken arm to your heart, to your liver, to your pancreas. How do you think life is going to be then? So I think just a small initial step is keep your foot on the gas, put health as number one and talk about it all the time. Don't let them forget about it. If you've got an electronic monitor in your break room, put health sayings up to keep them reminded, and then back it up and show that you truly do care about health by having a health fair. And I highly recommend you do extensive blood work, because from my examples that I've shown you, you really can help your people and help your healthcare costs.
Great. Thank you so much. Philip?
I would say consistency is a huge thing. Educate, and it's not just a once because it's the new hot topic. It's got to be consistent. The message has to stay consistent throughout the year. To Brian's point, having those discussions with your team on a continual basis, make sure that topic continually rises to the top of the discussion board. And I think that's something that's been really beneficial for us. And then the other big thing that I always encourage, and I mentioned it a little bit earlier, but when you have some of those success stories, share those. Some of the things that can be most impactful is when you help an employee go from an issue to resolving that issue, or you help an employee save a bunch of money because of a preferred value provider. Making sure that you're using those to continue to drive your initiatives. I think that's a big thing as well. And I also want to kind of dive into what Brian ended it with on his last, because I completely agree. I think one of the things that often happens, and I have a lot of discussions with other employers, and some of the things that Gamber Johnson is doing is that, some of the things that you hear about, like, oh, that seems like it's a lot of effort or it's a lot of work to go down that. And one of the things I always like to say, I think we all realize, hopefully we start to realize that the risk of inaction is far greater than any risk action takes, because for the last 10 years, most of the employers, if not all of the employers on this call, have experienced increased costs and degraded service. And, if we continue down this path, to Brian's point earlier, it's not sustainable. And I think one of the biggest risks we all have is if we don't take action. That's the biggest risk. Not everything that we've done at Gamber Johnson has been successful. But one of the things that we try to do and pride ourselves on is we want to make a continual effort to be a part of the change and help our employees. And that's been a big success for us. So I guess my closing remarks are, I think if you're worried about, some of the risk down the line or some of the effort, I can tell you that, the risk of inaction, in my opinion, far exceeds any risk of any action that you take.
Great. Thank you so much. I'm going to take some time now to tell the audience we'd like to get your questions. We're going to have some time to do those in a couple of minutes. So if you could begin putting them in the chat, we'll start monitoring and try and answer as many as we can. While we're waiting on you to do that, I just want to remind employers that the Alliance Network includes a number of preferred value providers that offer low-cost, frequently utilized shoppable procedures and tests that can be really impactful. You heard about that today from multiple of our employers. And when it comes to patients, they often get care where their doctor tells them to without realizing that they have a choice. So the Alliance has a number of educational tools, including a Find a Doctor tool that can help make it easier for employees to shop for care. There's actually a link in the resources box to a video we developed on that. So if we can be helpful, we would love to be. Most people don't put off screenings because they're lazy. They usually delay care because they don't know how to access it. It's confusing. It's inconvenient. And so we want to make it as easy as possible. So what we've found from this conversation so far is that removing barriers is really important. Making that preventive care easy to access is most important. Break it down into small chunks of information so it's less confusing and more convenient. Frame the importance of preventative care as a question. Let employees arrive at their own conclusions. I loved that example from Brian about, okay, you're thinking about your arm, that becomes a big deal. Well, you might not know that there's something going on with your heart or your liver. And those also affect you, just might not be as visible. No one likes to be told what to do, so asking what would happen gives them something to think about. And ideally, then people come to their own conclusions and will take more action. And then this was mentioned a couple of times today too, getting others from within the organization to talk about their preventative care journeys. That provides that social proof. It builds trust and it normalizes it. So keep in mind that idea of like spending money on the small things to help prevent the bigger things. So as we opened up today's session, I mentioned we're calling this year's webinar series a movement to bend the trend. And we're inviting everyone to be a part of it. Don't worry, we're keeping it simple. If you register for the next session, you're already part of it. Our movement is about testing small actions to encourage preventive care and ultimately lower healthcare costs. So what I want to know is how you plan to take action after today's session. We're going to put a poll up. What's one small thing that you plan to try before our next session? promote preventative screening in staff communications, talk about prevention at a leadership or team meeting, offer a small incentive or reminder for the annual checkup, offer training on how to access preventive care services. You're still thinking about it, or you've got another great idea that you want to share with us. Let us take a look and see if we've got some results coming in. Looks like we've got a lot of people picking promote a preventive care screening, talking about it in meetings, offering an incentive or a reminder. Those are all great first steps. And I think that's what we talked about at the beginning. What are those first small steps that we can take? So I appreciate everyone chiming in on the poll. And I think, we'll continue to revisit these action steps throughout the year. That's why we wanted to get some of these benchmarks from you all to figure out how are we improving over time. Each topic we cover is designed to help all of us lower our per member per month costs and bend that trend. So we hope to see you at the next meeting. I want to thank everyone in advance who took time to submit questions. So I'm going to start out with, how do I know what preventative care screening to focus on first? We touched on this a little bit in the meeting, that you can reach out to your account executive to look at your data. But do you all have any suggestions on where to start first? Maybe I'll start with Philip.
Yeah, I would say that's one that I would definitely reach out to my partners and review my claim data to figure out where can our strategies make the biggest impact. Do we have a high prevalence of diabetes and uncontrolled diabetes? That's going to be a good place to start from a prevention standpoint. Our annual program, we've tried to make it as simple as possible for employees and their dependents to participate. And one of the things that we do is we try to make it so it's not one size fits all, because we recognize that from one person to the next, things can be drastically different on what is needed. So we put that power into the primary care provider of their choice. And most of the time that tends to be our tier 1 clinic partners. But the form itself just asks that the employee to be eligible and to complete the program, be eligible for incentive, is up to date on their annual physical, any required blood work, and any age and gender specific screenings. And so, we leave that to our clinic partners to say, what is best for Philip, what is best for and maybe somebody else down the road, because, based on age, gender, and a number of different factors, what might be the right set of panels to run for me might be completely different than that. And instead of me trying to make that call from my desk in my seat as HR, I leave that to the medical professionals and try to give them as much autonomy, because that's what they're there for. That's what the primary care team is designed to do, is to make sure that they can be that quarterback of care. And we try to push that to our team as much as possible. So, if one of our clinic partners thinks that this employee needs to have these tests done, that's under their discretion to complete that program. We don't mandate specific things, and we leave that to our primary care providers.
That makes a lot of sense. Brian, do you have any thought on where people can start first? Obviously, like you said, Philip, we don't want to mandate it, but how do we get those reminders out there to get people thinking about it?
Yeah, I think the biggest thing in place to start is you've got to get that quarterback, that DPC, that independent clinic from specialty care. Number one, you got to do that. And I would highly recommend health fair for those screenings. That way, they're getting it done, and do it right at work.
Great point, making it as easy as possible. How can we measure results to know if our prevention efforts are working? Renee, do you want to start with that one?
Sure. Well, I know that, as a part of a provider team, we measure it by how the patients are doing, looking at labs, looking at their blood pressure, looking at their habits, if they've changed anything. The companies that we serve all have access to some of anonymous, no patient name included, but they do have access to some data on what we're seeing for our patients for, so they can monitor, are the cases of diabetes going down, they can monitor certain things. So I think that's very important, and that's kind of how we do things here and how we monitor. So.
And Brian, you don't have an on-site clinic. You're working with DPCs. How are you managing this? Are you just looking at your claims data, or?
No, we with our DPC, they give us monthly updates on utilization, and then we post them on the break room electronic monitor so that everyone can see. And then I also ask on outright how many haven't come in for annual physicals, and I just talk in general in the staff meetings where we set on annual physicals, and so that's what we do.
That's great. And I think that kind of big mass communication then doesn't feel like anyone's being picked out. They're all just, hey, this is where we're at with these types of screenings. We want to make sure you're all being healthy. So I think that's great. Philip, anything you want to add?
Yeah, I think working with the Alliance is a big thing. They have a lot of data resources to help you, as well as your broker partners. And I'm a big data nerd when it comes to healthcare as well. So there's a lot of great platforms and tools out there that can help employers understand the claims data, the trends that you see, whether it's Springbuck. I'm not promoting any of these particular DeerWalk. I don't know why they're both deer oriented, but Springbuck, DeerWalk, there's a number of other great tools out there, but work with your partners, the Alliance, and there's a lot of information in your claims data. I think one of the things that can sometimes be a little bit scary is as an employer, health is a really personal thing, and then diving into claims data might be you might perceive that as a violation of health or whatever it may be. But, on the contrary, I think a lot of employers and especially the panel speaking today, that data can be used for such powerful things to make sure you're navigating your healthcare strategy in the right way to help your employees. And I think it's important that you're taking a look at that, especially for self-funded employers, because, at the end of the day, we're a responsible party for our medical plans, and we need to make sure that it's built in a way that's the best for our employees and their dependents.
Thank you all very much for your time today. We really appreciate it. That wraps up today's event. It's always helpful to get kind of your perspectives on what's working in the day-to-day, and appreciate all the in-depth knowledge that you guys shared. If you would like any additional support on any of the content we discussed here, please reach out to your account executive here at the Alliance. We have experience with benefit plan design, and we're happy to help. Or if you're not a member of the Alliance and are interested in learning more about us, feel free to reach out to our business development team using the QR code or the contact us link in the resources box on your screen. If you're watching this webinar live, you can claim CE credit by clicking on the SHRM and HRCI links at the top right-hand corner of your screen. Wisconsin brokers, please remember to sign the attendance form via the link at the top of your screen as well. CE credit cannot be awarded without this. And finally, we'd love to see you at our next webinar. You can get all the details about this and other events on our events page. And be sure to follow us on LinkedIn. Just click the link in the resources box. Together, we can make prevention the norm, not the exception. Every small step adds up, and we're here to help you find your next one. Thank you for joining us today. And remember, when you think of the Alliance, think self-funding smart. Have a great day.